that you all have been all involved, and some of you more than others, in our ongoing conversations about, I noticed Rachel changed it from American Rescue Plan to relief and reform efforts, because this is an evolving, hopefully continuing to evolve, set of things that we're working on in conjunction with public policy partners. And I'll just give you a little preview. I just had this conversation with the steering committee, who's going to want to keep coming back to all of our members and ask. So when we started out, we did a work group starting earlier in the year to talk about American Rescue Plan implementation and funders' roles. We made the work group very intentionally representative of ECFC, which means that it was representing both national and state funders, and also tried to do multiple things. One of which was for the national funders, have them coordinate on some funding that they wanted to do to mostly national organizations, right? So like, let's talk about who's funding who and what concept papers do you have, and and then the state funders was much more, and Carol and Shana and Madeline Bayard from Rodell have been helping with us about like the very deep and intentional ways that our state funders partner with their state governments, or local funders on their local governments, on implementation of big public policy initiatives like this. So we've had several calls, we've had a tip sheet, we've had a memo. And the thing, one of our lessons learned, of which there are quite a few, is that like, that is a different activity. State funders talking with each other about their experiences at the state level is a different activity. The national funders talking about, are you funding in AOIC? I'm funding in AOIC, right? Like, what are we going to do? What, and so this is our effort as we head toward the end of this year. We've got 4 calls that Rachel's put here to create a space. And I know people are zoomed out, but we've been making member calls to all our members, and I've had at least 3 state-based funders say, I need practical, concrete ideas around this stuff. I don't have time to go to a bunch of webinars. And I'm noticing none of those folks are on this call, but but this is our effort to provide what we are hearing that people need, right? Opportunities to talk concretely with each other about what's happening in your state. And I also think we are challenged to think about the American Families Plan, and it's very daunting if you read it. I mean, it's exciting, but it's the amount of change that would be required in the way that states administer their early childhood programs to accomplish what is in this plan and in the bill that has been introduced is very daunting and would require much more transformative change than the American Rescue Plan has henceforth produced. And so I think that, that's what's on our minds, is like, how do you guys share concrete advice about things that are happening, ways you're partnering with your states, and how can we, as your professional network, learn how to get better at setting this up, heading into what could be an even bigger both opportunity and effort lift if we were to get the American Families Plan. So Rachel, that is my context. I don't know if I covered everything you would want, but.
I think you did brilliantly. I think that probably the next step is, unless anyone has questions about what Shannon just said, would be for us to just go around and real quick say who we are and what foundation or organization we represent. And then I'd love to share with you, we did ask everyone in the registration, what were you interested in talking about? And so I want to share that with you. And I think today we're going to focus in on the one that got the most mentions, which is workforce. But we just want to make sure we're making this space work for you. So we are totally open to your suggestions about how to prioritize and what to do differently. So for folks who I haven't met before, I'm Rachel Schumacher. I'm a consultant, and I've been helping ECFC for a long time on the Raising Childcare Fund. pooled fund, but then also started once the ARP things, the ARP thing, you know, the $50 billion was passed to support the table of funders who wanted to talk about that, as Shannon mentioned before. So let's just pop it to other people. I'm going to pop it to Portia.
Hello, hi, everyone. Glad to see everybody. I'm always glad to see everybody. Listen, my name is Portia Kennel, and I work for the Buffett Early Childhood Fund, and I'm glad we're having these get-togethers and learning because we are very interested in how this rolls out because it could make the difference that would make the difference in many, many families' life. I haven't seen anything like this since the 60s. So, I mean, I haven't. Maybe there has been something, that was for families since the 60s. And I think it's our responsibility and our reasonable service to watch it, to know it, and to support it in whatever way we can from our positions in philanthropy. Oh, hello.
Let's see. I was going to have you popcorn, but then I thought maybe before I even do that, I'm going to introduce April for anyone who hasn't met her yet. And April is our new program assistant at ECFC. So we're super happy to have her, and people should know Rena, who's also on here, our formidable team of folks trying to figure out how best to support you all. Okay, so now I'll pop to Sarah.
Hi, I'm Sarah Slaughter at the W. Clement and Jesse B. Stone Foundation. We're in Chicago, but we fund in 5 different states, so sort of straddle between being a state and a national funder. And I will first say, Portia used to be here in Chicago and is a legend here in Chicago. So it's always nice to reconnect with Portia virtually.
Thank you, Sarah. I'm kind of a fading legend. That's
no. But you know, I guess one thing I would say, Shannon, because to your how do you divide this up is, you know, and if as we get into the workforce, I can expand on this, but I also think that there has to be a connection between the federal and the state. And so perhaps, but also recognizing that we all have way too many meetings, Zooms to be on. So maybe a very intentional overlap between having some state folks who can join the federal stuff and some federal funders who can join the state. Because if what's happening in the federal isn't making sense and working on the ground, that's important. And the states have to be ready and, you know, for what's coming from the federal. So anyway, just an idea.
You guys don't know what popcorn means, do you? Maybe I'm hanging
Okay.
out too much. You pick someone else at the end.
Carol. I popcorn to Carol.
Thank you, Sarah. I'm Carol O'Donnell. I'm with the Connecticut Early Childhood Funder Collaborative. We're a collaborative of 20 funders across the state. And I would echo everything that's been said so far. I guess my biggest concern is the state capacity to handle everything that's coming down. And I see in our state where we're way ahead on certain pieces, but I don't know if we really understand what the sequence of pieces are and how one fits with another. And so I think that's my biggest concern. The other thing that I had raised with Rachel in terms of my registration is when we have national funders that are looking for place-based, they're looking for particular states to support training or technical assistance or pilots, you know, how do we make that connection between the national funders and the state funders? And I'll pass it to my colleague Martine in DC.
Thanks, Carol. Good to see you. It's been a minute. We're all so busy. I'm Martine with Washington Area Women's Foundation, Washington, D.C. And Washington, D.C. area. So I work across D.C., Maryland, and Virginia. And I'm specifically connected with ECFC because we host an early care and education funders collaborative for the DC region. And we're specifically focused on advancing the early ed workforce in the region at the moment. I don't know why I'm here. Everything that's already been said and probably more. It just, I saw the email and I thought that's the place to be. I do have some sort of lingering questions. I'm not sure if this is the space for it, but I'll just throw out one. How philanthropy or ways that philanthropy is supplementing necessary research to be able to implement the federal dollars strategically, so that states can put together sustainability plans, should they be able to. We had some questions recently, with advocates that we're working with around, well, you're waiting for some reports to come out from whatever state entity to be able to form your policy agenda. What are you going to need to do to gut check that data? What are you going to need to what do you anticipate is going to be missing from that data? Like, where can we fill in those gaps? So that's one thing that came up recently and it's still a pending question for me. I'm going to have to, I'll probably think of other things because those of you who know me know that I kind of stream of consciousness, but I'll popcorn to April for now.
Hi, I'm April. I am the new program assistant, and Rachel just did a little introduction to me, so I'll move it along to Katie.
Well, it's great to be with you all. I'm Katie Weir and a senior program officer at the Robert Wood Johnson Foundation. So as a national funder, I might be a lurker in this conversation. So please tell me if it's not appropriate to be part of this, but I'll say what I was coming into this conversation with was trying to better understand, as we think about work in states and state policy efforts, how to be a better partner. As we think about state networks, as we think about curating research or other ways to help look across multiple places, and then to help with, for instance, that budget advocacy and accountability that needs to happen for how the dollars get spent, as well as continue to make the case for dollars moving forward. Great to be with you all. And I will pass it to Nancy.
My name is Nancy Wilansky. I'm the Executive Director of Grantmakers Council for Islands. I'm a sister organization to ECFC. And I would put myself in the lurker category too, that I am trying to think through kind of what we need to put our weight behind locally in terms of proposals and infrastructure support from the rescue plan dollars in whatever area. I'm looking broadly. So just was interested to know what you all are focused on and what you're trying to see happen in the states, so that I can be aware of that for our local funders. And I don't know if anyone hasn't gone.
Al?
Al.
Yes, good morning, our time, and good afternoon to all of you. I'm Al Castle, the Chief Executive Officer for the Castle Foundation. We've been operating in Hawaii since the 1830s, came from Boston before that, where the family was philanthropically involved. All of you have pointed out things that are important to us, working with our state government to enhance their ability to actually manage some of the federal money that's coming down to us. The job that's been done so far has been kind of lacking in speed and wisdom in many cases up to this point. I think the one thing that hasn't been said here is, and it is a concern of mine, is there's a lot of ways that we can be helpful to the state And we have been historically and currently doing what we can to work with the state, everything from research to workforce development for our state. Frankly, there's a lot of needs in our state for consultants and for training on their behalf, as well as our nonprofit world. But the traditional role of the private family foundation has been to innovate, initiate, and to retain independence from government. And I think somehow there needs to be a balance between our desire to work with and help and enable state government and federal government, while at the same time retaining our essential independence, which is really the reason that, to some extent that we exist. I mean, that independence is more critical to me than ever. So yes, want to work with our state government, want to work with our federal government, want to work with all of our public and private partners, but we also want to retain a certain amount of distance so that we can do the things the state government will not do. A lot of the federal money coming down is highly tied, as you know, to specific purposes and specific ways of doing the job. And we need those who have some money and are also independent and can take the risks that state government, which is really in the compliance business, and not in the initiation business or the innovative business. To retain our independence is really critical to me, because that's what put us on the map 180 years ago, and I think we'll continue to do so. So other than that, I totally agree with what has been said here, and I look forward to listening in or participating as may be the case.
Thank you, Al. That was really profound what you just said. I'm glad you said it, even though you were sort of saying, well, it's the only thing no one else said. I think that is a big issue now, right? Is people want to be helpful and, build state capacity and all these things, but sometimes you have to be an independent voice and say differently than what people in the state maybe want to say. So that's a challenging balance. Well, I think, so you guys have named some more things, but I wanted to put up, these were the topics of interest that came out of the polling we did. So I'm putting them up, but before we so you can kind of see them there, but several of them are things that you all said. There were a couple smaller items that people mentioned on the bottom, the other specific challenges that didn't come out just in what you said verbally, but I'm curious to know, first off, any reactions any of you have to what other people said? Like, I definitely had my immediately wanted to react to what Al said, but I'm curious to know, did anyone say anything that you didn't come in here thinking you wanted to focus on, but now you do, or just anything that you want to just pose a question to each other? Because, Shannon and I are going to be like facilitating the heck out of this, but that's not really the point. We're trying to give you guys a chance to talk to each other. So I'm not sure if any of you want to just say something in reaction to what you've heard other people say in their introductions. Trying to make space for that. Okay.
Can I?
Yeah.
I was waiting because it's not me, but I just want to say one thing that struck me, because I've heard 3 other funders say it to me that aren't on the call, was when Al was talking about state government being in a compliance mode. And I've had several other funders say to me that part of the thing that they have observed, one of them was an Illinois funder, Sarah, it's not you, and they weren't talking about, they're saying, 2 people who you and I could both name to kind of have some sense of leadership, but everybody else is in compliance mode and it's holding us back. And I'm not really sure what a funder could do about that, but like that really struck me.
Mm-hmm.
I would just say, I think Carol mentioned this, and I would echo that there's such incredible capacity issues that just, everyone's drinking from the fire hose from, you know, the day-to-day issues to what's happening with the federal packages. And therefore it's hard to be visionary when you're just trying to think about how do I make sure, you know, people are wearing their masks and we've got, you know, blah, blah, blah. You know, so I think that's the capacity issue is, in my opinion, at sort of at the root of that.
Yeah,
Yeah.
Sarah, go
ahead.
ahead.
Go ahead, Al.
Oh, just to say, I agree with Sarah completely that, and you know, our state workers, I'm sure just like all of your states and maybe local governments are, because of COVID, are really up against the wall, and I'm not blaming anybody for struggling to get the dollars out and to comply with federal mandates. Understand that. And when we talk to the state DHS officials often tell me, you know, independence and initiatives are fine, but no time to even listen to them at this point. We simply have to get the money out because we're under pressure to get it out by a certain date. And as one very honest DHS official told me, we don't even care at this point. We just don't want to lose the money, so we need to get it out. And maybe later you can come tell us how we could have done it better, but don't really have a lot of time for you right now. That's sort of the gist of what I tend to hear from the Department of Human Services, and God bless them for doing the best they can do. I think Katie, I believe it was Katie that talked about the need to assess at some point. We can step back and assess how well we did or didn't do. I do see a need not only for more Department of Human Services people, but frankly, trained differently as well. Many of them are coming out of a training that took place 10 or 15 years ago. Maybe they're mid-level folks, or even 20 years ago. And so much has happened during that time that I think the way we think of our Department of Human Services, how we train them, is going to be a real issue as we go forward. And God help us if the Family Act passes and we're as unready as we seem to be right now for doing the job we need to be doing at the state level.
There's a very robust, you should have your chat boxes open if you don't, because it's a very robust conversation going on in the chat. One thing I was going to lift up was this idea of, you know, we're talking about making the biggest investment in social services and early childhood and all these things than we've even been able to dream of in so many years. And we are also we're also facing like these years and years and years of disinvestment and attrition and like actual people working in government and distrust of government, which someone here talked about. And so that's like that's one of the big challenges they're having with the CTC and, you know, other things, just getting people to want to take the program and then having the capacity to do it. So I'm hearing a lot of resonating around the state capacity stuff. I mean, so I'm wondering,
Rachel, I also just want to throw in, not to, you know, be completely negative about government, because I'm totally not completely negative about government, but I feel like I'm saying a lot of negative things about government today. You know, there's not just capacity issues, but there were existing lingering barriers to access existing funding, right? Like we all know in each state or each locality, there's barriers to certain families or certain programs accessing, you know, CCDBG subsidy funds. There's barriers to TANF access. There's all sorts of barriers, you know, intentional or otherwise. And I'm not saying that as like a, you know, that anything's done on purpose, but we know that they exist and they're slightly different in each state, but they do exist. And so even when we're thinking about beyond capacity, even if the funds were to be able to be put out there in the ether, and I think someone mentioned this, maybe this is related to the intermediaries question in the chat, is, you know, will programs, businesses, families, whoever, who are able to access the funds and are technically eligible for the funds, are they going to apply? Are they going to know to apply? Are they going to be able to get through that screening process due to technicalities. So that relates to, I think, to the, CTC implementation, I'm assuming, is one of the other challenges that was noted. But I think that's across the board, not just putting the money sort of out there in the ether, but also like depending on how the program is implemented or operated or whatever, it goes beyond a capacity question, and it also goes into sort of my thinking of what could, certainly our grantee partners' roles, right, in giving feedback on how those processes could be more open and reduce the barriers. But some of us can also give that feedback directly. Like I'm at a public foundation, so I don't have the same restrictions in lobbying, for example, as some of the private foundations locally. Mm-hmm. So like where are there opportunities for our partners, both grantee partners, but also maybe our intermediary colleagues, to give feedback on the policies and the implementation strategies for that money distributing as they're coming out, right? Like how can we be responsive to not just say, okay, we can fund these, to Al's point, yes, let's fund the innovation, let's take the risks. But then there's also like a monitoring piece and a partnership piece of, well, we give out money in a different context, but we've seen this as a barrier. And how can we give that feedback to our government funder colleagues or our intermediary colleagues to maybe open up those streams beyond the capacity issue? So I have a lot of those questions in my head too. But partially I'm sort of wondering if it's like, I feel like I'm just in this wait and see mode, right? Like I'm going to wait and see what someone suggests, whatever. I work across 3 states. So whatever state or locality suggests, and then, then I'll be able to respond to it. But there's so many question marks right now.
Right. Well, so I'm wondering if we should dig in a little bit on a topic and then look at it through the lenses you guys are bringing up, or whether you want to just continue to have more general conversation about this, because we had sort of teed up folks to think about the workforce issues, because several of you mentioned it in your questionnaire as something that you wanted to focus on. But it feels like maybe these issues of capacity and how can national funders help, and is there something we should be doing, what's our appropriate role with government here, are like lenses with which you can look at the problem and think about, okay, we all know compensation is an issue, but where's our capacity in our state to be able to respond? Is there certain technical assistance we think we need, or is it what would help us in this moment, thinking around these other things? But does that resonate? Sarah's going, but I don't know. Shannon, does that seem like the right way to go? Yeah. Okay. And we will continue to have checks on this as we go. So we did suggest, we did ask Sarah if she might start talking a little bit about the workforce stuff, because she's been thinking about it a lot in specific states, as well as also supporting some national work around this. And maybe we can just start off with you framing that a little bit and how you've been thinking about it and what you're learning, Sarah, as this implementation is going forward, and some of the challenges, and then we'll just take it from there, see how people react, and if we can apply some of these lenses.
As usual, I feel like all these topics, we could be on this Zoom for 5 hours, right? But so I guess I'd scrap everything I'd thought about beforehand and reacting to some of the comments that were just made. Because I think, Martine, like sort of your comment, when I thought about your comment with respect to the workforce, it made me think about, I think that there is an emerging change in how some of our grantees are going about the work, to have more of a feedback loop between some of the national advocacy policy organizations and grassroots organizations. So I think about sort of some of the work that CLASP is doing and using their national platform and expertise, but partnering with state and local organizations so that it does create a little bit of that feedback loop to make sure that what's coming down makes sense, and that the needs that are there at the state level are moving up to those federal advocates. So I think that's a promising development in terms of how folks are working together and how we might fund. And then I think the other thought that occurred to me is to talk to, and I think Katie is still here, sort of the federal, state, local connections, because again, you know, I see the Center for the Study of Child Care Employment, Leah Austin and her team, and obviously everyone I know knows about their index where they look at states on you know, each state and how they're doing with respect to the workforce. But their work now is they're working with 8 states and bringing them together to think about how they can learn from one another to effectively use those state dollars for the workforce. And then the idea is hopefully then they spread that out to others as well. And I know now they have a form that they're circulating that they're trying to get 50 sort of, you know, they're trying to get all states to start putting into a form how they're using the money on the workforce. So again, I see that as both pushing information out to make sure that the federal dollars are spent strategically, but also sort of that national research group combined with sort of the state actors, which I think is pretty innovative. And then I guess the last thing I would just say too, with respect to this, is that on the capacity issue, one of the things that I've done is somebody who's one of our state early childhood leaders who I have known for 20 years. And I find now, like, I can hardly get an email or a call answered. But when I said 2 things, I connected them directly. One, I connected her and her team with Leah Austin at the Center for Child Care Study Employment and basically said, here's the connection. I'm stepping back, ask whatever you want. And they had this robust conversation. And it was almost like they were embarrassed. They didn't want me to be the broker or go-between because the state folks had to know all the answers. But when they got this national expert, they sort of let their hair down and asked these questions. And the other time that happened was connecting both state and city folks and advocates with Danielle Ewing at Ed
Council, yeah.
Ed Council, thank you. And we had 90, this was just for Illinois, and we had 99 folks on that call. She also did it in Massachusetts, and I think she had like over 100 on that. So folks really, you know, it almost feels like, I don't know, they're so busy, they want to go directly to sort of some known national source. And, you know, that's fine. I can step out of the way. So those were a couple of things. And again, all of these were about how to use federal funds and combine with what's going on at the state level to get that money out wisely.
That's interesting. I just put in the chat. We also found it really useful to connect the Children's Funding Project directly to the Raising Child Care Fund grassroots grantees. Like, you don't realize that you feel like you can just pick up the phone and call Elizabeth Gaines sometimes and she'll answer and she'll be happy to set something up. But then all these people that you know in the states, you know, and the people you know in the state may not feel as comfortable doing that. So if you can make that happen, that can be super helpful. I don't know, what do other people think about? What are you wrestling with on workforce, or do you have a reaction to the stuff that Sarah shared?
Well, this is Al. I guess obviously I'm the only man on this call, I believe, now that I checked the participants, but we have a long partnership with the Erickson Institute and McCormick Center, both of which Sarah I know knows well. probably all know well. They've done a great job for us in Hawaii, training our public preschool teachers in early math and early literacy and SEL and a number of other things for us. And just last week, I was talking to Erickson. I know now is not the time, given the rush to get in compliant fashion, the DHS and getting the money out. But, I see, in addition to preschool workforce development, we do, hundreds of things in that field. I asked Erickson to think about how they could do some very specific sorts of training for our state DHS and maybe DOE compliance officers around what we mean by high quality early education. And we think, well, gee, that's such a basic thing. Let's hope that they do know. Well, they don't know in many cases what high quality means. And it isn't the first thing on the agenda, although they all agree it should be done. There are a lot of ways, I think, that we can pool, even when there's not a lot of money. Erickson said they would love to do it, to put together a couple of seminars that could be targeted specifically to what it means to have high quality early education, how it can be recognized and funded and rewarded for the DHS itself. But it's not a lot of money. I mean, they were saying, gee, we could do that with very little expense compared to what you're paying for the work that Erickson and McCormick Center are doing now and will be doing for us with in the preschool world, public and private. So anyway, we're talking about being independent and taking an initiative. I see an opportunity to do some training with our DHS using some of the Erickson, expertise tailored to the public servant work that needs to be done and will be done now and over the next several years. And I'm not sure that there's time to do it now because of the tremendous pressure DHS is under, but they recognize that they weren't really ready for some of this money, and they don't fully understand the vocabulary of the preschool world that they are funding in major ways, both at the state and compliance federal money.
I think Katie mentioned in the chat some links for a directory, a TA pool. This might be a good conversation to put for one of our next calls, because the steering committee at ECFC I just brought this up. I'm like, hey guys, let's think this through. Like, what would we do if there was this family plan? And they brought up two past examples that Sarah and maybe Al would be the experts on, where it was money at Build before the Race to the Top Early Learning Challenge, where people could get direct TA access, and I think also for the Early Head Start childcare grant. But that was we were like, but that didn't happen with the rescue plan. We couldn't coalesce people like that. So we're like, what's the difference? And those were more narrow. It was not like transform your whole system. It was like, there is a grant opportunity that you can compete for, and we are going to offer some TA to help you bring a state team together to get your grant together. So I don't know if you guys have other hypotheses about like why we didn't see that same amount of coalescing around the rescue plan, even though we gathered people at a bunch of conversations, and what that means for the family plan. But that I think would be.
Shannon, just to clarify, you mean coalescing around like the advocates ask?
No, coalescing around funders coming together to basically pool TA, like say, here is a place you can go, because I think Katie chatted this based on Sarah, like, oh, we're linking people directly with this expert, with that expert, and that's what they want. ECFC has facilitated that before. ECFC funders, and the other examples were like when there were these federal grants coming out, ECFC funders put money at Build so that people could just go straight there without having to do a procurement contract for a consultant or anything, and get like help with their application and pulling them together. Like, this is way bigger.
And Build was the technical assistance provider.
Yeah.
So I think that's part of the problem.
They subcontracted with a lot of people. Like, they did a lot of outreach to see who has time in the consultant community who could potentially help. That proposal did not get fund. Like, that kind of proposal sort of came up earlier in the year. But Katie, what were you going to say about that being the issue? Because I'm really curious why that didn't take off, and I figured there must be a reason.
Well, this is also conjecture on my part, so I'm just thinking aloud. But I think for that particular purpose, Build was seen by those individuals at the state as the go-to for the state technical assistance. I think this that we're talking about with ARP is so broad, there isn't a go-to in the same way. And so there's not like a natural anchor point. And so it is more of this constellation and figuring out too how we don't accidentally narrowly define what the TA that states can get. So my thinking about a directory was trying to help folks navigate, like, here's somebody who can help you with X if this is what you wanted to. And we have then a pool that people could tackle to say, hey, we have the capacity that we can help you buy it, or you can provide it depending on the state of flows. Because I'm mindful that that's a mistake we have made at the foundation. I have seen that in others as well, as we kind of have an idea because we've, talked to people in the field and we think this is a thing that should be, rather than creating a little bit more flexibility. And I think we're all trying to get better at bringing our boards along and building on that flexibility too. Certainly as a national funder, it's easier for me to fund into a pool that has state level work rather than trying to do an individual state for each piece of work.
And in Connecticut, we've had experience co-funding with a national funder. So to bring that kind of consultation to our state, we co-funded with Heising Simons. And that worked out very well, but they had the access to the consultation that we needed. Quite frankly, I think we're at a historic moment in many ways. In the fact that the issue is not really, long term, it's not really the money. I've got my funders looking for places to support things, but they don't know where to put their money. They don't know, which consultants they should support, which evaluators they should support. So it's a conundrum in that respect.
It's interesting. It's almost like we need, I was just thinking about this in terms of, because my son is starting to look at colleges, it's almost like we need, like what they do with professors, where people, like other state people, could sort of say, here was my experience, here's what I found useful about working with this consultant, and then people could help get matched without sort of going blind. Because I think that is, to Katie's point, she's saying, well, sometimes they want to pick their own person, and you can't just say this is the person we'll fund you to talk to, but then how do you pick? What are the pros and cons is another issue.
I was just going to say, to Katie's point, I know of a K-12 advocacy group in Illinois that for ARPA put together, and frankly, at first, I wasn't really impressed with it because it was like this laundry list. If you want to do this, there's 10 different things you could do, and you could pick from these 5 things. And it was like, my eyes were like glazing over. But I think in light of this conversation, I'm like, well, actually, maybe that really was, sort of a smart way of going about it, because it does give people choices that, because it's so broad.
That's funny, Sarah, because that was just to be totally frank, that was kind of my reaction to the proposal that Build put in with a bunch of other people, a big consortium, was like, oh my God, let 1,000 flowers bloom. We've already done this for like decades and it didn't get us anywhere. We got to pick a few things that are going to be the basis of this system and at least do those minimum things, so that's interesting, that reflection you're having.
Well, that's an interesting point, right? So obviously there's a lot of interest. Let's go back to workforce as our focus point. There's a lot of interest in pathways and compensation, really making it easier for people to access education, training, whatever, that they need, but also pairing it with compensation and pushing states more in that direction. Because then I think, is that something people feel like, I know in some states, like in New Mexico, they had some kind of legislation where there's the new department was supposed to be coming up with a career ladder and wage ladder that would then inform policymaking. Not every state is interested in doing that, which is why I think the 1,000 flowers bloom method comes up often from TA providers because they know that not every state is ready to do that. But as funders, you know what your state might be ready to do or where you want to push them. So is it a matter of getting clearer on, you know, ECFC state funder needs, like what they think they really want to be focusing on in this area, and then trying to build that capacity? Or is it more about, you know, you are thinking more about just the funding capacity? Because there's a matching fund idea that we sort of had this idea that Carol was saying national funders could put money in and then help states do things. Or is it more about a focus, like here's a focus on what we would like to see funded, and more effort to like really focus on compensation, for example?
I may, admittedly, I may be a little lost in the conversation. So if this doesn't make any sense, then just, you know, we'll just move on. But I'm curious about, you know, when we talk about having, you know, collective investments or pooled investments of some sort, in theory. No, it's not your fault, Rachel. I'm just, in life, I'm lost. If we're talking about having pooled investments for the example we're talking about is technical assistance for states, right, and implementing. And I'm actually curious about what it would look like for private philanthropy to come together around supporting community-based organizations, supporting the advocates, supporting you know, educator member associations, supporting the advocates insofar as they're working in coalition across early educator advocacy and workforce development advocacy. You know, like what would it look like for private philanthropy to come together and pull money for technical assistance and for them? Because when we're talking about government capacity building, I get there's a need, and that I don't want to like take away from that from the conversation. But I'm sort of like, my mind is going to, and then there's also going to be a need for you know, how the organizations that are going to be tasked with engaging and being the go-to people for our government folks on, like, I don't have time to do a full, you know, focus group analysis, landscape study. I'm going to go to like these 3 orgs, you know, and I think we all know who those orgs are in our localities. So I'm wondering about sort of, yes, the TA for government, but like, is there an opportunity as private funders to come together around capacity building and TA for those sort of on the ground folks who we know are going to get pulled in and likely have even less capacity to get pulled in right now?
Point of clarification, are you meaning, you're meaning the advocacy or the grassroots groups who are going to get pulled in?
Well,
or?
I mean, yes, but I mean, in my localities, a lot of the orgs are hybrid, right? Like you have a direct service provider that's also doing advocacy and they have to figure out their funding and blah, blah, blah. Anyway, so yes, but I think it's, I don't know that I'm thinking of, my mind isn't restricting it, if that makes sense.
Just to follow up, I agree with you, Martine, because I know we've had many convenings with our Office of Early Childhood as they move forward on ARPA, et cetera. And it's putting a strain on those providers / advocates. It's asking a lot of them in addition to their quote unquote day jobs, if you will. And so it's both a capacity issue, and then I think it's also a TA and training issue to support them in providing that input, that focused strategic input into our state policy, as opposed to all too often it's their individual stories or their individual concerns, and how do we aggregate those into a more collective voice? And they need some sort of infrastructure support to do that.
So I feel like I've been a yo-yo today as I'm listening to this, because, you know, I sort of like, yeah, maybe we should let 1,000 flowers bloom. But I also think that I'm pretty sure everybody on this call and ECFC, I mean, we're trying to be very much more intentionally and explicitly committed to equity. And not every, there can be some uses of funds that don't necessarily move in that equitable direction. And so I'm not sure what that means, but maybe it's like a sort of a SWAT team to go in and help, like when a state actor chooses their intermediary that they're going to work on, maybe it's like, great, you've made your choice. How can this sort of, you know, menu of SWAT teams go in and supplement what that intermediary doesn't have? And I don't know, I just feel, now I feel like I'm going back to maybe the middle of my yo-yo swing.
I hope that's a sign of a good conversation. So we're looking at the time, and I always think I'm always saying to Shannon, we should have longer calls. And she's always saying, no, we should not, because people actually are very busy already. So we have to wrap up. We do have another call. You know, we have these calls scheduled monthly. We can have conversation in between. Obviously, you know each other. You know, we're happy to make connections if you didn't know each other before you got on this call, and you want to follow up with this. But our question is, do you want to pick a topic to focus in on in the next call that we can do some background research and sort of teeing up and thinking about how to help frame that conversation, or you want to continue to have more of an exploring, how do we do this? You know, how can funders have this role, and how do we connect national and state? People are saying +1, but I don't know which one.
Well, I was +1ing because I agree with you, Rachel. It is both about state government and outside leaders.
Okay, yeah.
No question. However, to your question, I think I'd like to see us tackle some of these and keep moving along somewhat linearly, as opposed to just jumping around from issue to issue. I mean, I find these very helpful. I'm taking notes. I'm thinking of other things. But if we really want to move forward in terms of some action, I think we ought to take something that we talked about today and agree to look at that at the next gathering to move on. That would be my suggestion.
Do you have a nomination for what that should be?
I'll just put it out there and then I'll turn it to Portia.
Okay.
You look like you wanted to say something.
Oh, okay. Finish what you were saying. Sorry.
No, I don't have one particular. I mean, I could advocate for either the external in terms of how do we support the advocates. I love Sarah's idea of the SWAT team. That just the visual I got of descending on our intermediary, and then also how do we help? You know, how do we help the capacity of state government? I mean, one of the concerns that we have with our state government is, unfortunately, all of the positions have very strict descriptions because of the unions. So we have an agency with hundreds of staff, but only 3 of them have, you know, portfolios where they can be visionary, if you will. Mm-hmm. So how do we encourage our state government to, with any funds that they have, or externally with philanthropic funds, to have those visionaries? We've done it by supporting consultation, but there's probably other ways. So that's a long-winded way of saying I could go with either one of those 3 options, either focusing on infrastructure for the advocates, I'll call them writ large, Martine, or looking at how do we build capacity of state government, or is there something in between as such, Sarah? I just would like to see us move towards, you know, a little bit more discussion on one of those and maybe coming to some decision and resolution. But
right. You know, the only thing, this is complex. I know we got to go, it's 4 o'clock, but it's complex because where states are in terms of capacity is so different. So in that way, if we're going to do a collective pooling of something to support, it has to be a range of things of support, Because here we don't have a Department of Early Childhood. We had the Department of Education, and we got DHS childcare. I mean, we don't have it. We'd have to work kind of between those two departments. And I think every state has assessed this workforce issue from their, the advocates and other organizations, including private philanthropy. We have, and we've done it through an equity lens, and we decided that we're going to focus on equity, which means we've got to try to get more people of color into the pipeline, and those who are stuck in the pipeline for 20 years with a CDA to get an AA and eventually a BA. So that's where we're putting our efforts. We're not like doing the whole thing, but there is an inequity as it relates to people of color in teaching, as the school system turns more and more to people of color. So I don't know. I'm trying to figure out. It seems like we need, if we put anything together, it's got to have like 2 or 3 or 4 parts of it to deal with it based on what the states of our members and their plan and what they think is being tackled by boots on the ground already there. Sorry, that took me 2 minutes.
That's okay. I like Shannon's idea too, because I think like she does of having like a little tool, like a list of like, here's things in whatever was passed that no states are going to need to do. So we should probably be thinking, all of the state funders should probably be thinking about what the TA need might be. That is, but that's like a specific tool. It's different than the conversation that we could have here.
Mm-hmm.
So Portia's putting on the table, like, if that, Sarah and Portia both put on the table that we need to have an equity lens if we're thinking, if we're going to focus in on workforce. That's, by the way, why I put that link in the chat for the MBCDI and I want to say La Raza, but that's not what they're called anymore, paper on responsible transformation of the workforce, because I think that's helpful. Yes, Unidos. But I'm old, so I keep saying La Raza. All right, so I put in the chat, put in the chat, if you don't want to speak up, folks, now, what you want to have the next conversation be focused on, or if, it's 5:03 in Eastern time, so people are probably going to start signing off. I can stay another minute or two if people want to just talk more. But I think we have some ideas here. I think capacity building feels like a major focus of this conversation. It's just that, are we going to, is there also like a content area of focus, like this equity of the workforce piece?
I'm all about workforce all the time.
Work. Yeah.
Okay.
Well, I'm for workforce and equity.
Yes, I heard that.
Yeah, and I would be for that as well, as there are some things that we were just touching on that we could have had another good hour on today.
Mm-hmm. Okay.
Yeah, I would agree also.
And I also agree, we don't want to get into this, but I think supporting advocates to advocate for the plan in their states is a good thing too, but I know we have to choose one.
Well, not necessarily. I mean, I think we're going to sequence, right? We're going to have to have some sequencing. But for the next time, part of what we're going to do, I think Shannon would agree, is try to, depending on what's happened on the Hill with, we might have a particular focus around stuff that ends up in there. But I think we all know workforce will be a piece of that no matter what, because the challenge is going to be having a supply to actually provide all this newly funded care. And I think in 3 years,
way behind on the idea that you got to pay people if you want them to come to work. Right? Like, well, I just can't they've got all this money and there's like, well, we got to close classroom because nobody's coming to work. And I'm like, well, I mean, McDonald's is starting to get this and Walmart is starting to get this. Like, I don't get what y'all don't get about it.
So DC Council just passed, some of y'all know this, DC Council, I'm in DC, so I think we're a state. So DC Council just passed increased. They raised revenue. They're gonna raise taxes on some folks. And one of the things it's gonna go towards is increased compensation for early educators. They don't know how they're gonna do it yet. They're putting together a task force. But they did commit to that in the recent budget vote. So that's gonna be a big thing to figure out. And I think there could be a lot to unpack there and lessons learned, both good and bad and ugly for other states too.
Mm-hmm.
So I took a picture of this want ad, benefits, medical, dental, vision insurance, education assistance of $5,250 per year, debt-free college degrees, 401k retirement savings, career opportunities, paid time off. Chipotle.
Wow.
I just saw one, Burger King starting at $15 an hour when a lot of our childcare workers are making 12 or 13. 15, and they made a big thing, 15 to start with benefits, Sarah, just as you pointed out.
It's like,
Yeah.
Yeah.
Okay.
my son, go get a job, go.
I know, really. Okay, so Shannon, should we wrap this up and
Yes.
noodle on it? I guess we're gonna have to noodle on it and figure out, and if folks know how to find us if they have additional thoughts, and we're gonna capture the chat. We recorded this so that we can go back and think about it and try to make sure that we can have a useful conversation that sort of channels all your brilliance in our next call. So we really appreciate all the ideas you've shared here, and of course all the work you do every day for children and families. So we will circle back in a month.